In this video, I'll cover 10 essential community pharmacist interview questions, providing expert guidelines, ideal responses, and real-life scenarios to help you excel in your interview. This is one of 15 videos designed to fully prepare you for a community pharmacist interview. So, let's begin. Question 81. How do you approach dispensing medication to a patient with limited English proficiency? The following are guidelines of how to approach this question. Employers ask this question to evaluate a pharmacist's communication skills, cultural sensitivity, and problem-solving abilities when dealing with language barriers in a community pharmacy setting. The response should highlight strategies for clear and effective communication, including the use of professional interpreters, translation tools, and visual aids. The interviewee should avoid making assumptions about the patient's understanding or relying solely on a family member for translation, as this can lead to miscommunication and medication errors. A strong response should reflect awareness of PSI's guidance on patient communication and HSE resources for language support, ensuring that patients receive accurate and safe medication counseling. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. When dispensing medication to a patient with limited English proficiency, my priority is to ensure they fully understand their treatment. I use professional translation services such as the HSE's interpreter service or reliable translation apps for essential information. Additionally, I provide written instructions in their native language, where available, and use visual aids or demonstrations to clarify dosing and administration. If necessary, I encourage a trusted healthcare professional to assist, ensuring that communication remains accurate and patient-centered. My approach ensures patient safety, adherence, and confidence in their medication use. Example scenario. I remember when a patient who spoke only Polish needed guidance on their newly prescribed insulin. To prevent miscommunication, I accessed the HSE interpreter service and used diagrams to illustrate injection sites and dosage timing. I also provided a translated information leaflet for reference. The patient expressed gratitude for the clear explanation, and at their next visit, they confidently described their correct insulin usage. This approach ensured safe administration and improved adherence. Question 82. What measures do you take to prevent fraudulent prescriptions? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's knowledge of fraud prevention, regulatory compliance, and professional responsibility in a community pharmacy setting. The response should demonstrate attention to detail, knowledge of prescription validation protocols, communication skills, and familiarity with legal and ethical standards. The interviewee should avoid providing vague or generic answers and should instead outline clear, structured steps they take to prevent fraudulent prescriptions. Additionally, it is important to avoid making assumptions about patients without proper verification. A strong response should reflect knowledge of the misuse of drugs regulations, Ireland, 2017 and PSI guidelines on the safe supply of medicines, which outline requirements for the dispensing of controlled drugs and verification of prescriptions. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Preventing fraudulent prescriptions is a critical responsibility in pharmacy practice. I always ensure prescriptions are legible, complete, and meet legal requirements, particularly for controlled drugs. If a prescription appears suspicious, I verify the doctor's details and cross-check the patient's medication history. I remain vigilant for red flags such as unusual prescribing patterns, alterations on prescriptions, or excessive quantities. In cases of doubt, I contact the prescriber directly and, if necessary, report concerns to the Gardaí or the PSI while maintaining patient confidentiality. My approach prioritizes both patient safety and legal compliance. Example scenario. I remember when a patient presented a prescription for a high-dose benzodiazepine from a GP unfamiliar to our pharmacy. The prescription had slight irregularities in the signature and quantity, raising suspicion. I calmly engaged the patient with open-ended questions while I discreetly contacted the GP's clinic. It was confirmed that the prescription was fraudulent. I informed the patient that I could not dispense the medication and documented the incident per PSI protocols. This action prevented potential misuse and protected the integrity of the pharmacy. Question 83. What would you do if a prescription was written for a medication that is no longer available? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's problem-solving skills, clinical judgment, and ability to communicate effectively with both patients and prescribers. The response should highlight the pharmacist's proactive approach in identifying an alternative solution while ensuring patient safety and continuity of care. The interviewee should avoid dispensing an alternative medication without consulting the prescriber, as this could lead to legal and clinical consequences. A strong response should demonstrate knowledge of PSI guidelines on the safe supply of medicines and HSE reimbursement and substitution policies, ensuring that any alternative provided aligns with regulatory requirements. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If I receive a prescription for a medication that is no longer available, my first step is to check for alternative formulations, strengths, or therapeutic equivalents. I would then contact the prescriber, provide them with updated information on availability, and discuss suitable alternatives. If an alternative is agreed upon, I ensure that a new prescription is issued before dispensing. I also inform the patient, explaining the change and providing counseling on the new medication, if applicable. My priority is to ensure safe, effective, and seamless continuity of treatment while adhering to regulatory requirements. Example scenario. I remember when a patient presented a prescription for coamilazide, amiloride hydrochlorothiazide, which had been discontinued. I immediately contacted the prescriber, who confirmed the need for a potassium-sparing diuretic. We discussed an appropriate alternative, and the GP issued a new prescription for amiloride 5 mg alone, with separate hydrochlorothiazide if necessary. I explained the change to the patient, including dosing adjustments and monitoring requirements, ensuring they felt comfortable with their new regimen. This approach prevented treatment interruption and maintained patient safety. Question 84. How do you manage patients who frequently request codeine-containing medications? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's ability to recognize, manage, and prevent potential medication misuse or dependence while maintaining professionalism and patient-centered care. The response should highlight pharmacovigilance, communication skills, and adherence to regulatory guidelines for controlled medications. The interviewee should avoid automatically refusing supply without proper assessment, as this could damage the pharmacist-patient relationship and lead to conflict or unsafe withdrawal symptoms. A strong response should reflect knowledge of the misuse of drugs regulations, Ireland, 2017 and PSI's guidance on the safe supply of non-prescription medicinal products, ensuring compliance with legal restrictions on codeine sales and the promotion of appropriate pain management strategies. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. When a patient frequently requests codeine-containing medications, I first assess their purchase history and symptoms to identify any signs of misuse or dependence. I engage the patient in a non-judgmental conversation, exploring underlying pain management needs and potential alternative treatments. If concerns arise, I explain the risks of prolonged codeine use, such as tolerance, dependence, and withdrawal symptoms. Where necessary, I refer the patient to their GP for further evaluation and a structured pain management plan. My approach ensures that patients receive safe, effective, and responsible care while preventing potential medication misuse. Example scenario. I remember a case where a patient frequently requested Solperdine Plus for persistent headaches. After reviewing their purchase history, I noticed a pattern of frequent use exceeding recommended limits. I spoke with the patient about the risks of codeine dependence and suggested paracetamol or ibuprofen-based alternatives. The patient admitted difficulty managing pain without codeine, so I encouraged them to see their GP for further assessment. They later returned, grateful for the advice, as their GP identified an underlying migraine condition and prescribed a more suitable long-term treatment. This intervention improved their pain management while preventing further codeine dependence. Question 85. How do you handle a dispensing error that has already reached the patient? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's ability to handle medication errors professionally, ethically, and in line with patient safety protocols. The response should highlight accountability, problem-solving skills, communication, and risk mitigation. The interviewee should avoid minimizing the error, shifting blame, or failing to report it, as these actions can compromise patient trust and legal compliance. A strong response should reflect knowledge of PSI's guidance on the management of medication incidents and HSE's open disclosure policy, ensuring that the pharmacist takes immediate corrective action, communicates transparently with the patient, and prevents future errors. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. If a dispensing error has already reached the patient, my first priority is to assess the potential risk and contact the patient immediately to prevent harm. I apologize sincerely, explain the nature of the error, and provide clear guidance on corrective steps. If necessary, I advise the patient to seek medical attention and facilitate access to the correct medication as soon as possible. I then document the incident in line with PSI requirements, conduct a root cause analysis, and implement preventative measures to avoid recurrence. My approach prioritizes patient safety, transparency, and continuous quality improvement. Example scenario. I remember when a patient was mistakenly dispensed metformin 500 mg SR instead of metformin 500 mg immediate release. Upon realizing the error, I immediately contacted the patient, explained the issue, and confirmed whether they had taken the incorrect medication. Since there was no immediate risk, I arranged for the correct medication to be supplied at no extra cost and advised the patient on adjusting their dosing schedule. I then reported the incident internally, reviewed our dispensing procedures, and reinforced double-checking protocols with the team. This ensured that patient safety was maintained while strengthening error prevention measures in the pharmacy. Question 86. What are the key legal requirements for dispensing methadone in Ireland? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's knowledge of controlled drug regulations, compliance with legal frameworks, and ability to manage opioid substitution therapy safely. The response should highlight strict adherence to the misuse of drugs regulations, Ireland, 2017, PSI's guidance on the safe supply of methadone, and HSE's methadone treatment protocol, MTP. The interviewee should avoid dispensing methadone without a valid prescription or outside of HSE-approved guidelines, as this can lead to serious legal and professional consequences. A strong response should demonstrate understanding of prescription validity, record keeping, supervised consumption protocols, and patient safety measures while ensuring compliance with HSE and PSI guidelines. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. The dispensing of methadone for opioid substitution therapy in Ireland is strictly regulated under the Misuse of Drugs Regulations, Ireland, 2017, and the HSE methadone treatment protocol. Methadone can only be supplied by pharmacies registered under the MTP and requires a valid, specially formatted prescription from an authorized prescriber. Each supply must be accurately recorded in the Controlled Drugs Register, with daily supervised consumption required unless otherwise indicated by the prescriber. I ensure strict adherence to dosage instructions, counsel patients on safe use, and monitor for signs of diversion or misuse. My approach prioritizes legal compliance, patient safety, and effective opioid dependency management. Example scenario. I remember when a patient presented a methadone prescription with an incorrect date, making it legally invalid. I immediately contacted the prescribing GP, who confirmed the mistake and issued a corrected prescription. I explained the situation to the patient, ensuring they understood the importance of compliance with legal requirements. After resolving the issue, I dispensed the correct dose under supervision, documented the supply in the Controlled Drugs Register, and reinforced safe methadone use guidelines. This ensured legal adherence, patient care, and the integrity of the methadone program. Question 87. How do you ensure proper disposal of expired or unused medications? The following are guidelines of how to approach this question. To answer this question effectively, a candidate should demonstrate their knowledge of safe medication disposal practices, legal compliance, and environmental responsibility. Employers ask this to assess whether the pharmacist understands regulations, follows good pharmacy practice, and prioritizes public health and safety. The response should highlight familiarity with local disposal schemes, such as the dump, dispose of unused medicines properly campaign, and procedures for handling hazardous and controlled drugs. The interviewee should avoid vague or generic answers that do not reference specific protocols or regulatory guidelines. In Ireland, pharmacists must comply with the Misuse of Drugs Regulations 2017 and adhere to Pharmaceutical Society of Ireland (PSI) guidance on the disposal of medicinal products, ensuring safe handling and disposal of expired or returned medications. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. Proper disposal of expired or unused medications is essential to protect public health, prevent misuse, and minimize environmental harm. In our pharmacy, we encourage patients to return unused medicines for safe disposal through the dump campaign, ensuring they do not end up in household waste or water systems. For controlled drugs, I follow the Misuse of Drugs Regulations 2017, ensuring they are recorded and disposed of using an approved destruction kit in the presence of an authorized witness. I also work closely with waste disposal companies licensed by the Environmental Protection Agency, EPA, to ensure compliance with hazardous waste regulations. Additionally, I provide patient counseling on the importance of proper disposal and educate them on why they should never flush medications down the sink or toilet. Example scenario. I remember when a patient brought in a large quantity of expired benzodiazepines that had belonged to a deceased relative. Understanding the risks associated with controlled substances, I immediately followed the Misuse of Drugs Regulations 2017, ensuring they were recorded in our CD register and secured in the CD cabinet until destruction. I then arranged for disposal through an authorized waste management service, ensuring compliance with PSI guidelines. The patient appreciated the guidance, and I took the opportunity to explain why it's important to return such medications rather than keep them at home, where they could pose risks of accidental ingestion or misuse. Question 88. What are your thoughts on the expansion of pharmacist-led services in Ireland, such as vaccination and health screenings? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's awareness of evolving pharmacy practice, understanding of healthcare policies, and ability to contribute to public health initiatives. The response should highlight the benefits of pharmacist-led services, including increased accessibility, reduced burden on GPS, and improved patient outcomes. The interviewee should avoid expressing resistance to expanding services or focusing solely on potential challenges without offering solutions. A strong response should demonstrate knowledge of Sléinteachtaí, HSE pharmacy-led initiatives, and PSI's role in ensuring safe expansion of services, particularly regarding vaccinations, minor ailment schemes, and chronic disease management. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. I strongly support the expansion of pharmacist-led services, as it enhances patient access to healthcare and optimizes the use of pharmacists' clinical expertise. Services like vaccinations, health screenings, and medication reviews allow pharmacists to play a more active role in preventative care, reducing pressure on GPS and hospitals. This expansion aligns with Sléinteachtaí's goals of improving healthcare accessibility. While challenges such as workforce capacity and regulatory updates must be addressed, I believe continued training, legislative support, and patient awareness will ensure successful integration. Ultimately, expanding these services strengthens primary care and improves health outcomes for communities. Example scenario. I remember when the COVID-19 vaccination program was introduced in pharmacies. Initially, some patients were hesitant, but through clear communication and accessibility, we helped increase vaccination uptake in the community. I personally administered vaccines, provided post-vaccination advice, and reassured patients about safety and efficacy. This experience demonstrated the impact of pharmacist-led services, showing how accessible care can drive public health improvements. It reinforced my belief that expanding our scope enhances patient care and strengthens the healthcare system. Question 89. Tell me about a time when you had to deal with a difficult customer. The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's ability to handle conflict, maintain professionalism, and provide excellent patient care under pressure. The response should highlight strong communication skills, empathy, problem solving, and the ability to de-escalate tense situations. The interviewee should avoid being defensive, dismissive, or failing to resolve the situation, as this could negatively impact customer trust and pharmacy reputation. A strong response should reflect knowledge of PSI's code of conduct, which emphasizes respect, professionalism, and patient-centered care, ensuring that conflicts are managed appropriately while maintaining a safe and supportive pharmacy environment. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In my role as a pharmacist, I understand that customers may sometimes feel frustrated or upset, often due to medication delays, prescription issues, or misunderstandings. I always approach such situations with patience, active listening, and a calm demeanor. If a customer is upset, I acknowledge their concerns, provide clear explanations, and offer practical solutions. My goal is to ensure that the patient feels heard and supported, while upholding pharmacy policies and professional standards. By remaining empathetic and solution-focused, I can turn a difficult encounter into a positive patient experience. Example scenario. I remember when a customer became angry after being told their prescription was not yet ready, as they urgently needed their medication. They raised their voice and demanded immediate action. I remained calm and understanding, reassuring them that I would personally check the status of their prescription. Upon review, I noticed a clarification was needed from the GP, so I called the surgery immediately and arranged for an urgent resolution. I then updated the customer, apologized for the delay, and ensured they received their medication as soon as possible. By staying professional and proactive, I was able to de-escalate the situation and leave the customer feeling heard and satisfied. Question 90. How do you prioritize tasks in a busy pharmacy environment? The following are guidelines of how to approach this question. Employers ask this question to assess a pharmacist's ability to manage time, handle pressure, and ensure patient safety in a fast-paced environment. The response should highlight strong organizational skills, the ability to multitask, and a patient-centered approach to prioritization. The interviewee should avoid focusing only on task completion without considering patient safety or the potential impact of delays. A strong response should demonstrate an understanding of urgency, workflow management, and collaboration with the pharmacy team to ensure that all tasks, including medication dispensing, patient consultations, and stock management, are completed efficiently without compromising quality of care. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. In a busy pharmacy environment, prioritization is key to ensuring patient safety and efficient service. I start by addressing urgent prescriptions, such as those for high-risk medications or time-sensitive treatments. After that, I manage dispensing tasks, ensuring each prescription is accurately checked and dispensed. I also stay proactive by delegating tasks to pharmacy assistants where appropriate and ensuring medication queries are handled promptly. Throughout the day, I continually assess the priority of incoming tasks, maintaining focus on patient care and safety while ensuring efficiency and accuracy. Example scenario. I remember a particularly busy day when the pharmacy was short-staffed, and there was a long queue of patients. I prioritized urgent prescriptions, including a patient needing an antibiotic for a severe infection, as this was time-critical. While the prescription was being prepared, I delegated less urgent tasks, such as stock checking, to the assistant. I also ensured that a patient with a medication question about a new prescription was addressed immediately to avoid confusion or errors. By effectively managing tasks and maintaining communication with my team, we ensured that all customers were served promptly while maintaining patient safety and quality care. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.